All right, so let's talk about basic human needs. So basic needs are physical needs for survival and care to be given. We all need oxygen. In order to breathe well, you need to keep the head of the bed elevated, assist to sit up in a chair, report to a supervisor or your instructor if a resident is cyanotic, which means they have bluish in coloring. That can be around the mouth, the face, the fingers, or if they are short of breath. Assist the patients with exercises to help them breathe. We all need food. Feed your residents if they're not able to feed themselves. A couple of things to be really observant of is to make sure food is of proper temperature and that it's provided in a friendly manner, in a pleasant environment, and in appropriate amounts. A person who is 94 years old may not need to eat a steak, a baked potato, and a salad. They're not moving as much as you, an 18, 19, 20-year-old, are. Therefore, they do not need as much food as you are. And as you all know, we all need to have our teeth and we need to have saliva to ensure that we're able to eat and start digestion. Digestion begins in the mouth, so please make sure that your patients all have dentures or appropriate teeth and able to eat. Water. We all want to have water. Our body is mostly comprised of water, so let's make it within the resident's reach, and let's provide fresh water at periodic intervals. When we make sure that it's within their reach, if your resident doesn't have arms and you take in a glass of water and put it on a bedside table and say, "I've given you water," that is not ensuring that they are ingesting or taking in water. So shelter. One of the other needs we have is we want to be warm and comfortable. So make sure that we provide for warmth with extra blankets. The elderly tend to be chilly, so make sure that they're warm and that they're dressed properly. Let's make sure that we keep them out of cold and drafty areas. Another thing that we all need is sleep. In order to enhance sleep, we need to make sure we minimize noise and use of lights during hours of sleep. If someone can't sleep, a lot of times if you give them just a gentle back rub, that will help them aid in sleep. Patients who have pain are not going to want to sleep. They're going to be uncomfortable. Make sure that this is reported. Listen to concerns or worries of your residents that they may wish to express. Sometimes residents are scared of the dark. They're scared that they're going to die if they go to sleep. Hear what they have to say. Do not defeat or deflate what they're saying because it doesn't make sense to you. If they're scared of the dark, put a nightlight on. Elimination. Assist them to the bathroom if they need to go. Provide a bedpan or a urinal, and especially provide for privacy if they need to go to the bathroom. How would you feel if you were in the bathroom and someone sat there with the door wide open? It's not a comfortable experience. So if someone soils their linen, we need to change it immediately. And we're also going to work on a bowel and bladder routine. Usually we take patients or residents to the bathroom every hour to 2 hours to ensure that they have an appropriate time to go to the bathroom. The other thing we need for survival is activity. ROM stands for range of motion. If someone cannot move, we're going to help them with movement, and we're going to turn and reposition them at least every 2 hours. Activity. Help them with activities as they're able to tolerate, encourage movement, and encourage things that are interesting and engaging. For safety and security, we want to provide for warmth, establish familiar surroundings, explain procedures to them. There's nothing more scary than to have somebody walk in and you can't really see real good and you can't hear real good and they grab your arm and don't tell you what they're going to do. That's going to make somebody combative and want to fight with you. Talk to your residents about their room. Even if they're in a hospital, a nursing home, or a facility, it is still their space. Provide for a safe environment and promote use of their personal belongings. One of my biggest pet peeves is keeping your promises. If you tell somebody you're going to do something, do it. Because if you tell them you're going to be back in 10 minutes, they're coming looking for you because you told them that you were going to be back. While you may have meant tomorrow, 10 minutes is 10 minutes, and you don't want a resident harmed because they're expecting to see you. Maintain order and follow routines, assisting them to participate in establishing a routine as often as they can. So if they get up at 6 o'clock in the morning, we're going to encourage that they get up at 6 o'clock in the morning. stressed? What's wrong? Why are y'all not sleeping? You're like number 15 today.
Between 2 jobs and school and home.
Routine. Do we work the 2 jobs every day? Why are we working 2 jobs?
I need money.
For what?
Sleeping and college.
Are you saving it or spending it? Stop spending it. Stop spending it, and we don't have to work 2 jobs. Make a budget. Make a budget. I have to work X amount of hours to provide X amount of money. Quit spending it. You don't need to spend it. Stop it. So who's stressing herself out? Stop it. So who can control it? Write a schedule. Write me a budget. Okay? And go home and go to bed. Okay? So what time's lunch? Now? So in the next hour, I will get through what? The next hour. With my eyeballs open. And then I'm going to go home and I'm going to write a schedule. And I'm going to make a budget. And these are the things I really need to spend money on. And this is all the money I need. Okay? You're stressing me. Under control, not control you. Okay? Go eat. Bye. So to help reduce fear and anxiety, listen to residents' worries, and if there are worries that you don't know how to handle, report it to someone. If you can, ease their concerns when possible and check on them frequently. That actually decreases anxiety. Avoid rushing and assist your residents in a gentle manner. So let's actually talk about love and affection needs. We all want to have friends, we want to be accepted socially, we want a feeling of closeness, we want to have meaningful relationships with others, we want to feel love, and to feel those things, a lot of times that involves sexuality. So the need to belong, we need those needs met by a family or a support system, and friends oftentimes may meet this need for us. So the nursing staff a lot of times is viewed as family, and by making that connection, you often take time to greet your residents when you see them, even if you're not taking care of them today. Sit and visit with them for a few minutes if you're able, and show interest in them. So display warmth with a gentle touch, not yanking or grabbing them. Show acceptance of them by encouraging their unique qualities. We used to have a resident that we cared for, and she had 7 names, and she would sing it in harmony, and it was hilarious to me because one person usually can't do harmony, but somehow this woman did it. Provide care in a kind and friendly and considerate manner. So let's talk about self-esteem. We all feel the need to feel value and to have worth, and that is about ourselves. So seeing yourself as useful and being thought of well by others. So it doesn't feel very good to have one think that you're a snitch or a snake or ugly, But when you feel good about yourself, you kind of put that out there and people actually start to feel good about you. So one of our responsibilities to encourage positive self-esteem for our residents is to call them by their proper name, praise their accomplishment, discuss current issues, try to avoid political issues if you can, because you may not have the same views, and request your residents' opinion and show respect and approval of them. So let's talk about the need for self-actualization, which is experiencing one's own potential. This need is rarely ever met before we pass. It cannot occur until all other needs are met. That is the need for shelter, etc. And it's a feeling that a person is what you want to be. A lot of times we spend time reflecting because we have not met self-actualization. So how do we meet this need? We help our residents to assist and participate in meaningful activities, help them dress. When we look good, we feel good. So we want to look good so we can feel good. Encourage independence, allow them to do what they can do, and encourage socialization. Share goals with your residents and praise their successes and accomplishments. Know what the resident has accomplished in their lifetime and talk about it. So let's move on to our spiritual needs. Everyone has the right to worship and express their faith freely. You may not agree with or feel comfortable with the spirituality of your resident or your patient or your client, but they have the right to express that freely. It is best to listen and hear what they have to say without trying to contradict or change their opinion. So respect their beliefs, respect religious objects, and inform residents of places and times for services. Assist them to attend any religious services that they choose. If the clergy is present, provide privacy for them. And we always welcome all members of the clergy. So now we're going to talk about sexuality. So sexuality is expressed by individuals of all ages. It's a way to show distinct feminine or masculine qualities, and we do that in our clothing styles and colors, our hairstyles, things that we find interesting in our hobbies, and our sexual habits, which, yes, they do continue into old age, as well as our gestures. So sexuality can be expressed through sexual intercourse, caressing, touching, holding of hands, and yes, even masturbation. It's a right of all of our residents that they have to experience. Guidelines for dealing with our residents and their sexuality is to assist them to maintain their sexual identity by dressing them appropriately, be it male or female, assisting them with proper hygiene because when you look good, you feel good. Select attractive clothing. So you wouldn't put yourself in a plaid shirt and striped pants. Why would you dress your client or your resident that way? Fixing hair appropriately that makes them feel good. For women, applying cosmetics and putting on aftershave or perfume that's special. So we're going to help to develop a positive self-image, show acceptance and understanding of our residents' expression of love and sexuality by providing privacy. Always knock prior to entering a room at any time. Assure privacy when is requested. Never expose the resident, and always accept their sexual relationships. It is not our place to judge their choices. Provide protection for a non-consenting resident. So if you have a female resident who is attracted to a male resident, but the male resident does not want that attention, we need to protect the male resident from the non-consenting resident, which would be the female. Be firm but gentle in your rejection of residents' sexual advances to you. Yes, our aged residents are going to find some of you attractive. You need to ensure that you do not encourage those advances. So let's talk about some side effects of injury and illness on sexuality. So if you think about a disfiguring surgery that could occur to a person, for example, some people feel that an amputation is disfiguring. The patient themselves or the resident may feel unattractive and ugly to others. They may feel like they have been mutilated or they're deformed and unworthy of love and affection. So sometimes chronic illnesses as well, or certain medications, can affect sexual functioning. And some of those disorders can cause impotence, which means that the penis is unable to get an erection. Some of those diseases are such as diabetes mellitus, diabetes is what we call it, a spinal cord injury, multiple sclerosis, or alcoholism. Surgeries can actually have both physical and or psychological effects. So removal of a prostate or the testes, the amputation of a limb, removal of a uterus called a hysterectomy, removal of the ovaries, removal of a breast, a colostomy, or an ileostomy. So other disorders that can affect the ability to have sexual intercourse or have a sexual relationship could be a stroke, nervous system disorders, or heart disease. So disorders also, as we continue, could be chronic obstructive pulmonary disease, the inability to breathe, circulatory disorders, arthritis, or conditions that affect mobility and flexibility. So the reproductive system, the organs have dual functions. They produce reproductive cells, which make us male-female, which also make us have the ability to have children. Produce hormones responsible for sex characteristics, and you guys need to know that the hormones for females are estrogen and progesterone, and the hormone for male is testosterone. So some of the other common disorders of the reproductive system are rectocele or cystocele, which are hernias. The rectocele is the weakening of the wall between the vagina and the rectum. In this case, you can have constipation that results and hemorrhoids would form. A cystocele is the weakening of the wall between the urethra and the vagina, which causes urinary incontinence. So tumors can be benign and malignant, tumors of the uterus, ovaries, and breasts. So we need to ensure that patients have pap smears, self-breast exams, as well as biopsies if needed. So some of the sexually transmitted diseases that our patients could potentially have, which are common disorders of the reproductive systems, are gonorrhea, syphilis, herpes, and AIDS. They can also have prostatic hypertrophy, which is an enlargement of the prostate gland. I hope you guys remember from 9th grade that the prostate gland is actually a male organ. And patients can actually have vaginitis, which is inflammation and irritation of the vagina. So changes that we see in the reproductive system due to aging is decreased size of the testes, decreased production of sperm, delayed or less forceful ejaculation, slower sexual response, enlargement of the prostate, and decreased sexual desire. In women, you can see sagging breasts, stopping of ovulation, decreased vaginal secretions, thinning of the tissue of the vaginal lining, decreased sex hormone production, and loss of hair in the vulva area. So some of the things we need to watch for and observe in the reproductive system is complaints of pain, vaginal discharge, complaints of itching, lumps that are not normal to the person, as well as bleeding. And this concludes our discussion about basic human needs and how to meet those needs.